Legacy Hospice. Compassion at the end of life. Our standard of care for our patients must always be at the level we would give to our own family. Visit us today at legacyhospicecares.com.
Series that Legacy Hospice is offering in order to familiarize patients, families, and facilities with some of the complementary therapies that we do at Legacy Hospice. Today is going to be a talk on aromatherapy, which will be a general discussion, and we'll also then discuss how we utilize aromatherapy in our patients at Legacy Hospice. Throughout recorded history, humans have been aware of the marked effects of scented plants on their bodies, minds, and emotions. Essential oils help you to harness the power of fragrance through the science of aromatherapy. Aromatherapy uses plant materials and aromatic plant oils for the purpose of altering one's mood, cognition, psychological, or physical well-being. And that's part of the reason that we are using aromatherapy right now at Legacy Hospice. Aromatherapy is considered to be a branch of herbal medicine. So what are essential oils? Essential oils are pure, natural, volatile, and aromatic substances created in the cells of plants and extracted by a variety of means. Essential oils are very highly concentrated. An example is it takes approximately 60,000 rose blossoms to create 1 ounce of rose oil. These highly concentrated substances are found in a variety of materials in the natural world. These include leaves, stems, and twigs, an example of which is cypress, flowers, blossoms, or buds, and these would be all of the floral essential oils like jasmine, rose, neroli, fruit or the peels of fruits, and these would be things like lemon, lime, mandarin, tangerine, woods or barks, and one of the more common ones is called cedar wood. There are also essential oils created from the resins and gums, and one of the most commonly well-known is frankincense. And roots and bulbs, which is one of the common ones again, is ginger. We also get essential oils from seeds, kernels, and nuts, and a really wonderful one is cardamom. So how do essential oils work? What happens that these are able to create changes in our mood and emotions? There are 2 mechanisms of action which have been well studied and have been determined to be both the influence of aromatherapy on the brain, especially the limbic system, which is triggered through the olfactory system or sense of smell. There is also a direct pharmacological effect of essential oils because each essential oil has its own unique chemical characteristics and compounds which are unlike any other, much as traditional medicines have their own specific chemical compounds. Once the olfactory system is stimulated by the essential oil, again through the scent of smell, electrical impulses then go to the limbic system, which then triggers the hypothalamus, which is kind of the director of our brains. These messages then, as they stimulate the hypothalamus, can control blood pressure, appetite, heart rate, neurotransmitter levels, and regulate both the immune and endocrine systems in our body. So chemistry is actually the foundation of aromatherapy. Each essential oil has a very wide variety of chemical constituents that affect our physical, mental, emotional, and even our spiritual sense of being. The best method for using aromatherapy is actually through direct inhalation, which means directly smelling it. This is because when you directly smell the essential oil, it goes more quickly into the bloodstream by crossing the blood-brain barrier and is actually in the blood within 7 to 10 seconds. This is the reason that we use it in our patients. We are able to If someone's anxious or feeling upset, by putting the essential oil on their clothing and having them smell it, we can usually have some sort of effect happen more quickly. There are other methods of using essential oils, several of which I'm sure many of you are familiar with, including diffusion. You can buy a diffuser pretty much anywhere now at Walmart, Target, Walgreens, and with a diffuser, you just put the oil and water in and it diffuses around the room. This is a method that we don't use for our legacy patients, and I'll discuss exactly how we do use it and why we do it that way. You can also use essential oils in massage. It can be put in the bath. You can use it therapeutically as a compress, and you can use it as a spritzer just to make your room smell nice or in steam. So how do we administer our essential oils at Legacy Hospice? We follow a really important safety consideration and protocol, and we follow the philosophy of the Hippocratic Oath, which states, first, do no harm. So we're extremely careful about how we go about ordering essential oils. So the process begins by talking with the physician, the family, the caregivers, the nurse at the facility, the RN case manager to see what symptoms our patients may be experiencing. And these can be anything from anxiety, depression, poor sleep. Some patients, especially nowadays with COVID, are very, very lonely, and some of the oils can help that. They can also stimulate appetite, and some of them can do things like decrease heart rate. So we look first to what symptoms we are trying to help the patient deal with. At that point, then I do a careful review of the medical history. We want to make sure that the oils we choose do not have any kind of effect on history the patient has, such as seizures, blood pressure, heart rate, things like that. The essential oils can affect all of these things, so we carefully review the medical history. We then review all the medications someone is taking, including allergies, and I have an essential oil safety book, which we very carefully check to make sure that there are no interactions between our essential oils and medications that the patients are taking. After the essential oil is chosen and discussed at length, we do have a doctor's order, and we follow guidelines by the physician who is actually in charge of the patient. What we do to administer the oil is place it on a little round of cotton and tape it to their clothing. This usually is done twice a day. We do it in the morning to help with symptoms people might be experiencing during the day, and then again at bedtime with the intent to help people sleep. The essential oils are only left on the patient by taping it to their clothing for 3 hours twice a day, and this is because it's been determined that essential oils remain in the bloodstream for anywhere from 3 to 6 hours in healthy individuals and for up to 14 hours in people who are ill, debilitated, or elderly. There are some other safety considerations that I would like to include in this talk. Probably the most important one of which is that we recommend that people never ingest or swallow essential oils. Again, they are very highly concentrated substances, probably 50 to 100 times as strong as like the spices you might use in cooking. So the essential oils can be very toxic. If taken internally, they can erode the mucous membranes of the mouth and throat, and people have been found to have severe injuries from doing that. This is, again, something that is never recommended. The next thing that we'll discuss is the idea of putting essential oils on the skin without a carrier oil. A carrier oil can be anything like a lotion, could even be olive oil if that's what you would choose to use, but it means that we're putting the essential oil in another oil to dilute it because of the high concentration that it has. This keeps from having injury to the skin and can also help from people developing what we call skin sensitization, which is after overuse of an essential oil or using it daily, people can develop a rash that actually never leaves and can be quite uncomfortable. We always dilute essential oils, again, because of the high concentration of chemical constituents. And again, we follow that practice of doing no harm to anybody. So if you're thinking of using essential oils yourself or using them on a family member, making a recommendation to a friend, it's always important to remind them to review their medical history, to check in some type of safety book to determine whether this is something that's appropriate for them, and then to follow the guidelines of how to use it. People can also have allergic responses to something that we might think is actually a very common oil, and that's because depending where the essential oil is harvested from, the chemical constituents can actually be different. I recently found out that we have on Washington Island, Wisconsin, several lavender farms, which are wonderful, but the lavender grown in northern Wisconsin on Washington Island has completely different chemical constituents than the lavender perhaps grown in France or England, because of the soil, the type of rain that falls on it, the climate, and so forth. So it's always important to check for allergies. One other safety consideration, if you're thinking of using essential oil, is photosensitivity. That means that the essential oil may cause you to have a reaction to the sun. Many of us love the citrus oils because they make us feel happy, they elevate mood, but if you're using a citrus oil, even with a carrier oil, it will create sensitivity if you're in the sun. So people are reminded to stay out of the sun for up to 12 hours after using a citrus oil. As we're getting towards the end of this discussion, I'd like to just let you know other few special cautions, and that would be the use of essential oils in children, in pregnancy, and in the elderly. So essential oils are commonly discussed as being very safe and not very harmful. This is without people knowing perhaps that they are highly concentrated. It can have toxic effects. So there are very few essential oils that are considered to be safe for babies or children perhaps under 7 or 8 years of age. Two of them that have been discussed as being safe are lavender and rose. But prior to using any essential oils in any child or baby, it would be very important, again, to either discuss with a certified aromatherapist or to discuss after looking in one of the safety books that you may find. Pregnancy is another important thing to consider with essential oils because many of them can cause premature delivery in the first and second trimester, and even in the third trimester, some essential oils are not considered to be safe. So if you're pregnant or you have a friend who's pregnant, just use significant caution and do a study review before you use any essential oil. The elderly also have different constitutions. They don't metabolize chemicals the same way as many of the younger, healthier people do. And if you're thinking of using essential oils on the skin in an elderly person, again, you would want to dilute that so it's very, very low dilution, because the skin is very thin and then the essential oil would travel into the bloodstream very quickly through the skin. Many of us have pets and consider them to be part of our household, and therefore think it might be nice to use essential oils for our pets just in general. Or if we have a pet who's experiencing something like separation anxiety, one that has problems with thunder and lightning, perhaps has a wound, it's a nice idea, but there are also some safety considerations for our pets, especially cats. They have found that essential oils, pure essential oils, can be toxic to cats because they metabolize things differently and have a very different liver than perhaps a dog or a horse. There are co-products of the distillation of essential oils, which are called hydrosols or floral waters, which are felt to be safe for cats, small or frail animals, and wild animals. But it would be really important not to use a regular essential oil for any of these categories. Dogs, however, are frequently treated with essential oils, but again, a consideration needs to be given to the fact, as we know, our pets are very smart. So we need to give our dogs the opportunity to actually choose the essential oil they would like you to use. How do we do this? Well, you can probably choose 3 or 4 oils that may be something you think would be beneficial to your dog, and then give them the opportunity to smell it, either by holding them up to its nose one at a time, or you can set them on the floor several inches apart and let them just wander up to them and smell it. The way that you would know your dog is interested or would like that essential oil is they would be very interested in the bottle and maybe even lick the bottle, letting you know that it's something that they would like to do. The last thing I'll say about pets, if you are using aromatherapy, especially with a diffuser, do it in a room that has an opening so your dog or cat or whatever pet is able to leave the room when they feel that they've had enough. So safety is very important for all of our patients, and it's also safe for all members of our family, even our furry friends. So this concludes today's presentation on aromatherapy. I am the Director of Complementary Therapy at Legacy Hospice and also a certified aromatherapist. So if you should have any questions or concerns, or if your family member is using our aromatherapy program and you'd like to talk further with me, you're welcome to contact Legacy Hospice. The business office would be the best way, and that number is 262-879-8014. That's the end of today's presentation, and I look forward to seeing you again in the next 2 presentations, which will be about anxiety, and then another one on other therapies that we use to treat anxiety. Thank you.